Good afternoon. Amy Tong from the Office of Systems Integration. I'm the Chief Deputy Director of the office.
Great, thank you.
Hi. OSI is the project management arm of the Health and Human Services Agency, and in today's agenda, 4 of our projects have an item to be presented to you. 2 of them requires a budget change proposal, and Melody Hayes, our Deputy Director over the project of ACMS, is here to present that.
Thank you. Madam Chair, Melody Hayes from OSI. Your question was to go over the request, and then the other question was how will the department ensure that we will meet the target implementation date, so I'll address both of those. So this request is simply a net increase in spending authority for this year to cover an extension in our procurement schedule for the project. And when the project was first approved, it did not consider a new process that the state is doing to actually make procurements better. And it's called a draft solicitation process, which allows us to survey the vendor community, release our procurement documents and get their feedback and comments. And then the idea being that the official release of the document will be a much stronger document and will result in a much better solution for the state. So the schedule did not account for that. It also did not account for the federal reviews that we were required to have for our project because it does have federal participation. So the result of that was essentially a 9-month schedule delay in the procurement activities. So this request is simply to align the budget with the revised schedule for the project. And the ask is also for the extension of 1 limited term position to support the procurement activities due to the delay. And so that's $131,000 of the total request.
Any questions? Good morning, Senator Stone. LAO? Finance? Nothing. Now we'll have public comment on the overview and this current budget change proposal.
Thank you, Jessica Bartholow with the Western Center on Law and Poverty. We just want to comment as a reminder that there are multiple ways to reduce the costs of hearings, and certainly increasing staff and reducing the penalties as a result of late hearings is one way, and we support that. Although many of the wonderful, excellent candidates that were recruited came from our own piles of people, so we miss them dearly on our side, but glad to see them over there. But the other way to reduce the impact of hearings and the cost of hearings is to reduce the complications of the programs. In fact, we know that today the Hearings Department receives many requests for fair hearings for the maximum family grant rule. Rules like the maximum family grant that just don't make sense to normal people, right? That a child that's a baby who's born poor would be ineligible based on how their mother what kind of contraception their mother used. These things don't make sense to people. So when they get denied for these reasons, when they get denied, based on things that don't make sense, they appeal. And those appeals go to the appeal department, and then your folks have to explain to them why this is the law. So we would just encourage the Budget Committee to remember that we can continue to reduce inefficiencies in our overall systems and the costs of the hearings by making the programs make sense for regular people. And we've already seen a reduction in the numbers of hearings as a result of the drug felony repeal that happened last year as a result of your leadership, Chairwoman, and the leadership of Senator Hancock. So congratulations for that, and we look forward to more program rules simplification in the near future. Thank you.
Thank you. Next witness.
Yeah, Kevin Asner, Coalition California Welfare Rights Organizations. We work very closely with the State Hearing Division and appreciate their openness to work with us on just about everything. And we also support the BCP, and they've been very open with us on building up the new system that would bring them into the 21st century. Right now, the system they have is like the 19th century. Thank you.
Thank you. I'll entertain a motion to accept BCP number 2, to approve it. Thank you. It looks like it's unanimous. Beautiful. We'll move on to the final section of today's agenda, item 5180, Department of Social Services Automation. I'm going to try to keep us moving, colleagues, to get us out, although these are some meaty issues, so I don't know how successful I'll be, but I'm going to try. Got you. Automation, we're going to start with oversight of child welfare systems, the new system informational.
Yes,
Let's see, why don't we do, I just want to give the public a heads up. We'll take public comment after the second item on leader replacement by SAW. So heads up, public, we'll take public comment after number 2. So thank you very much, welcome.
Okay. Hi, I'm Carolyn Nordstrom. I'm the Deputy Director of the Child and Adult Technology Support Division at OSI, and I'll be reporting, giving you information on the Child Welfare Services New System Project. The Child Welfare Services New System Project will procure, implement, and maintain an innovative statewide system to support child welfare practice in California to ensure the safety, permanency, and well-being of children at risk of abuse and neglect. In addition, as part of the scope of this project, the state is pursuing an optional solution component to support the practice of licensing children's residential facilities. Your question about the project timeline and project costs. Currently, the new system project is at the beginning of the procurement phase. As Melody spoke about the procurement process, having a pre-solicitation draft of our RFP, we have, at the end of March, released that pre-solicitation draft for vendor comment on our requirements, and we're expecting vendor feedback concluding tomorrow. Prior to that, at the beginning of, or about the middle of February, we also released a draft of the RFP out very broadly for stakeholder input. It went to child welfare workers, probation, adoptions, and also technology experts out in the counties. And so we went through a process of receiving comment from those county stakeholders, and then the project team went through all of those comments that were received and organized those into themes and had a series of WebEx meetings with those stakeholders to discuss those comments, answer further questions, and get further input on those on that input into the RFP. So when we finish the stakeholder input or the vendor input that comes back tomorrow, the project team will be working on that to finalize the RFP, which will be released to officially start the bidding process around near the end of September of this year. We expect to award the contract around February of 2017, and our current estimated schedule is for statewide system implementation around November of 2019. And the current project budget for the project is $449 million. Regarding how the OSI is working with CDSS to ensure that the system's on course and that there are appropriate and competitive bids, I touched on that a little bit in terms of our stakeholder involvement process, making sure that we have included all of the stakeholders who are involved in delivering these services and really taking to heart all of their input and making sure that we then incorporate that back into the RFP, as well as the input that'll come back from the vendor community to make sure that we have a RFP document that's going to result in a system that's going to meet the practice needs for California. And we'll just continue that ongoing stakeholder engagement process throughout the procurement. Are there any questions?
Senator Stone.
Yeah, thank you for the presentation, and I'm certainly supportive of getting us to a better automated system. It's just kind of sticker shock for me that a software program would be roughly $450 million.
The total project budget is more than just the software, though.
Okay.
So it includes the state staff who are working on this,
Right.
as well as county staff, the whole conversion and training and organizational change management out in the counties, in addition to the software.
Okay, so is there like an engineer's estimate for what the software bids are going to come in at?
We have an estimate that's in our special project report, and the current estimate for vendor goods and services is about $87 million for design, development, and implementation.
Okay. You know, I've only been up here 4 or 5 months now.
That much longer.
I know it.
You're seasoned.
But one thing that I've witnessed is that we've had extravagant cost overruns and delays for computer systems throughout the state of California. So as we go through the RFP process, is there a way in which you're going to refine it in such a way that we know exactly what we're going to pay, we have a contingency for uncertainty, and make sure that we stay on budget? Because we're talking about a lot of money here. And so I don't know what's gone wrong in the past in the state. I just know it's been a pervasive problem that I don't want it to happen on my watch while I'm up here. So what safeguards are you putting in place that we are going to try to reach our goal of spending what we think we should spend with the appropriate contingency for things that unexpectedly happen during the design of these very complicated programs? And number two, while I didn't always agree with this gentleman, but he said one thing that was kind of compelling to me, Ross Perot. He said there's nothing wrong with stealing a good idea from somebody else. So we have big states, New York, Texas. Do they not have systems that could complement our needs in the state of California that we could borrow from them, buy from them? In other words, are we recreating a wheel that may already exist out there?
So I'll start by answering the second part of your question, if you don't mind. The strategy for the procurement of the child welfare system is what we're calling a COTS or transfer system. So COTS means commercial off the shelf, and transfer would mean taking a system that was built and implemented in another state and porting that over to California, and then wrapping around that customization to meet the additional practice needs as well as the complexity of California in the way that we do child welfare. So we are, and there was a study that was done before the feasibility study went in that evaluated costs for building the system completely custom from the ground up versus a COTS/transfer solution, and it was determined that that sort of transfer solution was going to be the most cost-effective for the state of California. So that is our strategy going forward, and we expect that the vendors that are going to bid on this are ones that are experienced in providing child welfare systems for other states in the country. So that is our strategy.
And to address the first question you have, Senator Stone, that yes, we absolutely recognize the current track record of the state of large IT project has not something that's been not something near stellar. Given the fact that many of the cost overrun as well as the schedule overrun, as you mentioned, it start with the request for proposal process. And therefore, this particular project, along with the ACMS earlier one, that project you just have heard, are implementing what we call a pre-solicitation process. What that means is that before the final RFP reaches the street for the vendor to respond to, we are putting a draft version to solicit vendor community's feedback, not only from a terms and condition perspective, what attracts the vendors to respond, therefore we have good competition, as well as from commenting the proposed schedule in this draft and the proposed cost, hearing from them what are the considerations we need to be plan ahead. With those response back to our drafting process, then we can revise the RFP to hopefully reflect a more realistic budget as well as approach and schedule in treating these projects.
Can you just briefly tell me how the sealed bid process works in the state of California? You put out the RFP, you advertise it, you have a vendor that's going to be giving their bid for this service. Who receives the bids? Who opens the bids? Who approves the bids?
Right.
Want me to answer? Sure. We'll be working with the State Technology Procurement Division, which is part of Caltech. And the process is a two-step process where we have an evaluation of the technical proposal. And so we look at all of the vendors and STPD oversees that and makes sure that all of the bids are compliant with all of the procurement regulations and that they meet all of those requirements. And then we apply the evaluation methodology that's laid out in the request for proposal to determine, you know, that the proposals have met the minimum qualifications to have their cost proposals opened. So only those bids that meet those qualifications have their cost proposals opened, and then STPD opens those bids, and they again oversee the evaluation process of looking at and scoring the cost bids, combining them with the technical score, and then determining what the best value proposal is for California.
And is it ultimately the department that makes the decision on who the vendor is, or does it go back to the legislature for codification?
It's based on the evaluation methodology that's approved and laid out in advance, and making sure that we follow those evaluation procedures. And so it should, that will result in the apparently successful bidder, and then a report goes forward recommending a contract award.
It
does
would be
not
the
come back to us.
department will be making the department. And if I may follow up, one more point I'd like to make in terms of ensuring the success to the best we can of the project. In addition, from a vendor solicitation perspective, we also have a very close working relationship with our program sponsor. Kevin Gang from the Department of Social Services here perhaps can speak to more about the stakeholder engagement, because aside from the technology solution, our users, our customers of the system plays a huge role in defining what the expectation ought to be.
Kevin Gaines, Social Services. Just to give a sense of scope, it is a big project, high cost. So we're talking about approximately 21,000 users throughout the state, child welfare services, social workers, line staff. We expect that that subset of users to increase slightly. We're looking at information exchange opportunities and opportunities for other users that we haven't seen before. For example, teens who are part of the foster care system being able to access certain pieces of their records or retain certain pieces of their records for later use, driver's licenses, social security cards, that sort of thing. Data entry from public health nurses who are visiting, completing visits and that sort of thing. So we're expecting a larger set of users. Okay. We have a set of benchmarks in order to secure federal financial participation, a set of requirements that we expect to meet and exceed. We also have a set of business process requirements and needs that have been negotiated with counties, county staff, our other stakeholders, that we think we're going to meet and exceed with this system. And so it is a big cost. However, we're looking at an ongoing maintenance cost that is approximately half of what we're paying now annually for the current system, which is, as I like to say, state of the art for 1989.
Well, you bring up a very good point, and that was going to lead to my next question. Is that I've certainly learned in 10 years in being in the county that we've bought some very expensive programs, and because the programs are unique to that vendor that helped put together that software, they have a monopoly on software maintenance. So I don't know if you plan to include in your RFP what is going to be the future costs of maintaining that software, modifying that software as contemporary changes in our ability to provide services changes, and also, which I think is also very important, is the financial wherewithal of the company, because it has not been uncommon for municipalities to hire or contract with a software company that makes the software, and even midway through the project, they go bankrupt. You know, now you got to have somebody come in and try to take on where they left off. And when you're talking about this kind of money, I hope that it's through the RFP process we look at their track record and their financial wherewithal and their ability to continually provide the support that's needed. So I know it's complicated, and this is why it gets very expensive, and I'm just trying to figure out ways in which we can tighten the process to make sure that they don't exercise their monopoly over us in a way in which it costs the state a lot of money.
The two things I would add, Senator Stone, to all of the lessons learned and new practices put into place is the state's and government in general policy to go with the lowest bidder. With technology and emerging technology and building huge multiple user systems like this, you know, as my mother would say, first class is sometimes cheaper in the long run. And so I think that that's a government attitude that's really got to change when it comes to building systems. And secondly, the finite number of companies who have the capacity to build in these projects, many of them have failed us repeatedly, and they shouldn't get to bid again. They shouldn't be granted major contracts when they have failed repeatedly on not just like, you know, other levels of government, but state contracts. Why would we trust them a second, third, fifth, sixth time? And I realize that's challenging because there's you know, not many who meet all the standards and have the capacity to build these systems that are larger than some, you know, national government programs, but we have to do a better way. But the lowest bidder gets the contract, I believe, sets us back every time. And so we have to create a mind shift about that, as well as getting used to the reality of the big numbers, because it's going to cost, and really being able to, in a significant, meaningful way, you know, monetize the short and long-term savings that efficiencies will yield. That is my pet peeve.
Brief, just to summarize the response to the various varied salient point, and yes, we are vividly aware of this challenge in front of us. The qualification and the track record of vendor is definitely one of those criteria we like to put in as part of the screening. The financial stability of a vendor is one of those items that we want to make sure the company has its financial means to last with us this long and, you know, through the ups and downs. The ability to not to go for the lowest bid, but the best value.
Right.
It is a criteria that we're actively working with our departments to draft those selection criteria so it's meaningful rather than just lowest bid. And coming back to the ongoing maintenance costs, as well as ability to outsource to various vendor, not to be tied to a monolithic vendor that has started from the very beginning. It is from a evolution of a technology and the architecture requirement. We are putting those in as a way of componentize the support of the system. So we achieve that agility as well.
Thank you.
Excellent. Were you ready to move on to oversight of leader?
Yes.
Good afternoon. Madam Chair, members and staff. Curtis Knapp, Office of Systems Integration, the division that I have has both EBT and leader, LRS. The OSI is responsible for overseeing the success, and there are different flavor at OSI, some different flavors of things we have. The one that Carolyn just talked about is a full development effort. What I'm going to be talking about with LRS is a county consortia, of which OSI provides oversight, and EBT is a service contract, so a little bit different flavor on all three of those. OSI is responsible for overseeing the successful implementation of ongoing operations of systems developed by the SAS Consortia, which LEADER is one of the three that we're converting to what's the LEADER replacement system. Some of the major activities include facilitating strategic planning, securing project approvals and funding, procuring and managing specialized consultant services, which I'll talk a little bit about IV&V, monitoring consortia activities, service delivery, reviewing deliverables, and most specifically, monitoring risk and determining mitigation factors. That's part of what my division does. A little bit of quick background is the first concept on replacing LEADER was in 2007, went out to procurement, concluded negotiations 2010, starting actual work in November of 2012. For a big project like this, that's not a bad timeline. Three things have happened in the most recent past, and it's discussed a little bit in the summary, is that We do have quarterly updates with legislative staff. We just most recently had ours in February, and it was very successful. We also provide an annual report to the legislature that was delivered in March, and those were all good reporting efforts. But then shortly after providing the annual report, we sent out an update regarding the schedule, but I'm happy to report that both scope, schedule, and costs for LRS are on target. Scope of work has been clearly identified. We have completed, LRS has completed the 5 build stages by December the 31st, and they entered into the system test life cycle. It's a very large effort. We have an IV&V consultant on site. They meet with us here in Sacramento on a weekly basis every Monday. We had a couple of areas of concern, and one was the magnitude of system test, a very large work effort. Because of what they were looking at, and we make weekly visits down to LA, we have staff to make weekly visits down there, it was determined that it would be prudent for them to use another month of system test for 2 factors. One is we're looking for quality work. 2, and in complement to LA, they recognize that they plan to move into pilot in probably September. They're very, very cognizant of how it's received in their pilot office. The pilot will represent about 6 to 7% of their caseload. It's a perfect fit. And so they move back system test 1 month, which means it moved back their user acceptance testing, of which county folks will be participating, as well as some CDSS staff. I've got Todd Blands here with me, and he can speak to a little bit about that. The schedule as it exists right now is to complete a system test by the end of May, move into user acceptance testing. That will go until pilot. Pilot will be in the last part of September. It's going to last about 4 months. There's a stabilization period, which is some things that we've learned over time with our automation rollouts and so forth. And then eventually there'll be 5 waves of rolling out the rest of the counties, and that's to be completed by November of 16. So we're about 1.5 years away from fully implementing LRS. Might be noted that for the most part, we're using the technology that the other consortia see for from a platform perspective. And so Senator Stone to talk about the theme about reuse. I think we're getting that message and trying to move in that direction. So at this point, we're based on facts. We're comfortable with where LRS is at.
Any comment on this item from LAO, Department of Finance? Any public comment on this item? Looks like we have a taker.
Yes, good afternoon. Kevin Anthony, Coalition California Welfare Rights Organizations. We've lived through a number of different systems. Leader, when it came in, it was a nightmare. They just went live and took years before people got used to it. And then Calvin came in 2001. On a Saturday, I went to a mock interview. At the mock interview, they were not even able to process my case. So Monday, they went live. And there is no independent verification done by an independent entity that the system is ready to go. What happens is the internal systems certify that the system is ready to go. And I think that, I mean, and if they don't do something about it, LRS is going to be the same nightmare that Cowan was and that Leader was. I hope it doesn't, but I just want you folks to know. Thank you.
Thank you.